Hi, my name's Hillary. I am a student at the University of Lethbridge. I am in the Recreation Therapy program, and I currently work in children's mental health here in Halifax, Nova Scotia. So, I'm going to talk a little bit about reactive attachment disorder. So, reactive attachment disorder is also referred to as RAD. It's a condition in which an infant or a young child doesn't establish healthy attachments with parents or caregivers. So, reactive attachment may develop if the child's basic needs for comfort and affection and nurturing aren't met, and that loving, caring, and stable attachment with others are not established. So, many children diagnosed with RAD have experienced some sort of neglect or trauma or instability in their care from a very young age and results in a different negative attachment with their caregiver or parent or adults in general. I have a video here I'd like to share, goes into a little bit more detail of what RAD is. It's geared more towards parents, but I think it can be really helpful.
Reactive attachment disorder is a serious disorder that occurs when an infant or child is unable to form attachments to parents or caregivers. They struggle to form stable relationships. This usually happens when a baby's basic emotional and physical needs are neglected for extended periods of time. Some of the situations that put children at risk for RAD may include the child living in a children's home or facility, frequent changes in caregivers, inexperienced parents, absence of parents or caregivers in the child's life, or any time the child is not being cared for by the parent. While these can be difficult situations for children, it's important to understand that not all children who experience separation have reactive attachment disorder. Every child responds differently to situations. A mental health professional can diagnose your child for this disorder. The literature also states that reactive attachment disorder is rare and uncommon. So if you believe your child may struggle with RAD, be sure to work closely with a professional. What are possible signs of reactive attachment disorder? Well, children with RAD rarely seek comfort when distressed or rarely respond to comfort when it's given. They may be irritable, fearful, or sad with adult figures, even when there's no real threat. Your child also needs to have had a history of neglect, and they must not be diagnosed with autism. It's really important to work with a mental health professional to really determine if your child has RAD. So once your child is diagnosed with RAD, what can you do? Treatment for RAD will focus on establishing a relationship with a caregiver that is healthy, stable, and consistent. Inconsistency may reinforce the idea that caregivers or parents are not to be trusted. It is important to be consistent and remain consistent in your child's life. It doesn't mean you have to be perfect. You should just be consistent and acknowledge when mistakes are made and go back to the established rules. Trust will be based upon the perception of the child and not the parent. It's easier to understand it from the point of view of the child. Children who have been hurt will often find other ways to protect their emotions. It will take time to break down those barriers and establish new ways of relating to caregivers. This will take time. Treatment with professionals and behavioral skills are the most effective treatment for RAD. The behavioral skills on smarter parenting can be a great way to begin working on the relationship with your child. Visit the website and specifically the section about reactive attachment disorder for more information. Don't forget to subscribe to our channel as well.
All right, so hopefully that video was helpful in the more of the details of RAD. So I'm going to go over some of the common characteristics that you might see with a child with RAD. You may not see all of these, but these are kind of the common behaviors. So they may have difficulty seeking out or accepting physical contact. It may be uncomfortable for them, or they may even be overly affectionate and not know boundaries with adults or other people, even strangers. So social and communication, they may avoid eye contact. Not seeking out for help when they need it can be common. Maybe they appear withdrawn or they have difficulty connecting with others, and they may have overall lagging social skills. They may have a need or a feeling to be in control of their environment due to that, the lack of like trust and relationship. So they may have defiant behavior or low self confidence, irritability, sadness, fearfulness. And another thing to note, they may show out of proportion reactions to small amounts of stress. So what might seem like a small thing to us may be they may be feeling a big emotion, and it might be a kind of an out of proportion reaction to a small stressor. And they may have difficulty expressing their emotions as well. Some co-occurrences that are common with RAD include ADHD and memory function. This may include shorter attention span, impulsivity, lower concentration, excessive movement, or even difficulty with remembering. So, some of the best communication strategies working with an individual with RAD is to be clear and concise with what you're saying, kind of be use simpler terms, child-friendly terms, especially when going over like the rules, the safety guidelines. Any type of front loading is really helpful for children with RAD to know what to expect in order to like build that trust and connection, letting them know what's going to happen, what to expect, what are the rules, what are the safety guidelines, what do they expect from you, or what do you expect from them. Things like that can be really helpful to do beforehand. So again, using direct language, child-friendly language, allow time for processing, and involve the writer in maybe creating a goal together. So asking them what they want to get out of the time together, or what are their expectations, or something that they would like to learn, something that you guys could create together could be helpful in building kind of a relationship and building that engagement. And the goal can be very simple and small. It doesn't have to be too big. So some facilitation strategies, I find using like the helper strategy. So making the child like your helper. Oh, can you help me do this? Or having like a little task or a job for them to do can create motivation. And reducing distractions is really important. Using pictures helps, maybe even pictures of the facility, pictures of the equipment, or pictures of the steps that you're going to take, and allow time for processing, not throwing too much information at once, and allowing them to ask questions and just take some time in between your explanations to let them process it. And with individuals with RAD, building relationships can be difficult. Building trust can be difficult. So it's really important to be friendly and welcoming, things like that. Some volunteer modifications that you could use to increase motivation or increase engagement for the child. A short icebreaker to welcome the rider could be helpful. Lots of child-friendly icebreakers, again, to build that trust with you and the other adults there with the child. So that can be very helpful. Repetition and routine, that can be really helpful in creating familiarity for the child. So they know what to expect. They know this routine and repetition, and they become more comfortable in that environment with that kind of modification. And setting expectations and front loading, like I talked about, letting them know what's going to happen beforehand, and to decrease the amount of stress that they may be feeling. You can use simple step-by-step instructions. I find that really helps, breaking down the steps into smaller steps. And pictures can help with that as well. So maybe breaking down something into smaller steps alongside pictures may be really helpful. using praise like awesome job, you're doing so great, you're so good at this, things like that can go a long way. And validating their feelings as well. So making sure like it's okay to feel nervous. It's okay if you don't know what to do. I'm here to help you. How are you feeling? Kind of checking in on their feelings like in that way. And providing time for a break or time for a snack or a water break can be really important to help them not feel overwhelmed, and again give them opportunity throughout to ask questions. You might need to prompt them to ask questions. They may not ask questions on their own, so things like that can be really helpful. I have also attached two links with additional resources. So the first one is the Association for Training on Trauma and Attachment in Children. This website has some really great information. And connect attachment programs and resources. There's some programs on this website for anyone who works with a child with RAD, even parents, caregivers, professionals, volunteers, anyone who is in the circle of someone with RAD. Those programs can be really helpful. And overall, I hope this presentation has been really helpful for you guys. Thank you so much. Bye.